Well, thank you very much for being here. As you can see, I'm with the Minister, Dr. Mkhize, and our Premier Zigalala, and MECs. It's been a wonderful visit to KZN. I've been given a full and thorough and detailed report about the work that the Provincial Command Council is doing here in KZN. I've been hugely impressed with the issues that they are managing and how they are managing the process of dealing with the crisis that we have on hand from a health point of view, the various measures they are taking to ensure that we continue flattening the curve, minimizing the infections as much as we possibly can, and also the communication and the public education when it comes to informing people about the importance of social distancing, about wearing of masks and washing of hands, because those are the key elements that are going to make us ensure that we flatten the curve of infections. The other important thing that they have been doing a lot of extensive work on is on the social distress side, the way in which they have organized the various structures in the province, the district development model, the Operation Sugumasake, as we call it here, how those have been put in place to make sure that we relieve the distress that our people are going through in terms of the food parcels, the way that they've organized the distribution thereof, and just helping our people also when it comes to issues of ensuring that the grants do go around properly and all that. But they've also been looking at the economic aspects, particularly as we are now in level 4, how we begin to get ready to go towards the recovery of our economy, because COVID-19 has really had and is having a huge negative impact on our economy, and they are on top of that, they are managing that and trying to ensure that we do get to a point of recovery. And I've been also impressed with the way that they've been getting ready for the spike in infections that is going to happen from what the scientists and epidemiologists tell us, setting up of hospitals. I've just been to the new Pixley Kaisa Kaseme hospital that is going to be opened soon for coronavirus patients, and also these centers here that have been put up, and the number of beds that have been prepared, and the level of preparedness is quite impressive. They've already rolled out many beds, and together with the various hospitals that we've got in the province, I think we are really ready for the increased infections and those who will get sick. So Dr. Mkhize and myself are quite satisfied with the work that the province has been doing. I'm rather pleased I came because it does give one satisfaction to know that at the government level, and together working, of course, with the various other sectors, we are ready here in KZN. So my visit has been a very good visit. I'm delighted, and we'll go to other provinces to also go and check the state of readiness. Thank you very much.
Thank you.
Thank you.
Does you have a response to the tobacco industry taking down?
Well, we live in a free country, and the content of our democracy is such that if you feel aggrieved, you are entitled to take your grievance to the courts of our country, and that's what they've elected to do, and we still have great confidence in the courts of our country that they are able to examine matters and disputes properly, and that's how it is going to go forward.
Mr. President, sorry, just a question on the draft regulation. When you said that the cigarette ban was made in tandem, it wasn't simply your decision. You said that, you said that it was taken from a draft framework. You're not in the habit of usually making announcements based on draft frameworks. How was that done?
Well, when we announced and said we are going to level 4, we did say that we are obviously we are a very consultative government, and we do consult on a number of issues. And there are many of our people, citizens, who have become accustomed to that, who know that if there are matters that come across in an unsatisfactory way to them, in a way that does not please them, they know that the democracy that we have is such that they can raise those concerns, and we are a listening government. Much as we can have decided on an issue, and if our people raise concerns, we listen and we re-examine our positions, and that is precisely what happened. So that was done, and it so happens that it was done on a very controversial issue, and this is by no means the only issue where we've listened to our people and changed tack. So this one is controversial, and we accept that. I said as much yesterday in my newsletter, but it is a matter that was decided on collectively, and listening to our people, we heard the serious concerns that were being raised by our people, health-wise and all that, and we decided that we should re-examine that, and we discussed it and changed our position. There is nothing wrong whatsoever in any one of us changing their minds. And you can ask yourself whether you've ever changed your mind on anything, and you'll find that you've done it more times than just sticking to a position that you may have taken originally.
Thank you.
So this brouhaha on this issue really should not even be there, because none of us is trying to pursue any interest. The only interest we're pursuing is the health and the interests of our people. That is all. Finish and clear.
Thank you very much. From the Premier.
KZN is a hospitable and disciplined province.
Yes.
We can't let you go without our Premier.
No. Our Premier must
a formal vote.
Yeah, of course, yeah.
No, thanks. We want to thank the President for the time he has spent with us, as well as the Minister, and for the guidance they've provided. We also wish to thank them for providing the leadership on this issue. President, our approach has been very simple. In times of disasters, you only plan and pray for the better, but prepare for the worst. And that is what has informed us, and we thank the MEC for Health and the Department on the plans they have made. I think we are taking step by step, but for now, for us, it is the main priority. It is to ensure that we stop the spread and the infection rate must be reduced. So we're working on that. We'll continue to work on that, but with all other plans in place in case the situation becomes worse. Thanks a lot, President, for leading us and for being with us. Lastly, I think it is fair to thank all members of the civil society for their support, especially the religious sector, the business sector, and traditional leaders. But even the colleagues from the fourth estate, they've been very instrumental in educating the society about this pandemic. And we thank you a lot, President. Thank you.